The goal of therapy is to help people get their lives back. That's what people want. They want to connect with their kids. They want to be able to have quality relationships with their loved ones. They want to be able to go out and enjoy life again. And PTSD is a thief. It steals those things from people.
My parents come from Bosnia and Herzegovina. From my family just going through the war, that gave me like generational PTSD as it is. And my dad, he didn't have a great relationship with my mom. And at the age of 11, he assaulted her, ended up going to prison, then a couple years later got deported. So I didn't have a father figure during my teenage life, which led me to have more severe PTSD and get into drugs.
My PTSD symptoms were anxiety, depression. I dealt with a lot of anger that I couldn't identify. Sleepless, always on high alert, just not being able to eat or rest or feel comfortable around people. Just feeling like someone, if I'm alone with someone in a small and close area, that they would hurt me or harm me in some way. So a lot of fear.
For one, I didn't know I had post-traumatic stress disorder, right? For two, I didn't care, right? And then the third thing is it didn't stop. You know, it just kept going. And then more things piled up, you know.
My name is Dr. Debra Kaysen. I'm a clinical psychologist. Written exposure therapy, in many ways, isn't a new therapy. It comes from work that's been around for quite a while about using writing to help people make sense of and organize distressing life events. But what the treatment developers did was really meticulous research to both see how to use this technique to work on very serious events, traumatic life events, and to look at how to structure the therapy in a way to increase people's response to the treatment.
My name is Dr. Ebrahim. I'm a family physician. My role is a chief medical officer. I'm responsible to implement kind of medical policies and also taking care of almost 40 providers that we have in the clinic. Community Healthcare Center, Inc., located at North Central Texas. We are taking care of underserved patients. We see pediatric patients up to 99. I had a patient 104 years old. When we decided to work with the team, it was my first time hearing about the written exposure therapy. I Googled it. I went to kind of figure out that what exactly we are talking about because I never received any training on this therapy, and our providers, they were willing to engage and then learn about the treatment.
In the first session, typically what would happen is the therapist would explain how the therapy is supposed to work. They teach a little bit about what are the symptoms of post-traumatic stress disorder. Many people may have all of these symptoms, but no one's ever told them what those mean. And it can feel like someone's going crazy. Why am I having these nightmares? Why is my heart racing when anyone walks up behind me? And all of a sudden they find out, oh, this label, that's what this means. So that's the first step, is what is PTSD? And then we start a process that's called exposure. And exposure is just a fancy label for something that many of us know about, which is approaching something that we're scared of or that brings up really strong memories again and again until it becomes less distressing.
First couple of sessions, I'm like, oh man, this is hard. I gotta cry. So, I'm crying as I'm writing and, I'm taking breaks. But then they started to get easier. It started to get it started to feel like saying my truth and no sugarcoating it, just being 100% raw about what happened and how I was feeling and how I still feel about it today.
So with written exposure therapy, each writing exercise is pretty brief. People tend to write for about 30 minutes in a session. And then they spend the end of the session talking with the therapist about what it was like and what they noticed by doing this writing exercise. The next session, the therapist gives them feedback about how to improve or how to build on what they wrote the session before. So for example, I noticed that you put in a lot of details about what happened during the event, but this time, can you write more about what you felt? Write about the emotions. Written exposure therapy is effective in 5 or 6 sessions.
Those patients that they completed the 6 sessions, we have seen significant changes in their behavior, psychological behavior, even somatic behavior. I have seen some of them coming back to me, and then by just seeing them that they are happy or they are happier than before, it's very fulfilling for us, for all of our providers. And it's easy to implement. It's not really difficult. In a day-to-day busy practice as we have here, we have almost, we see 500 patients per day. We were able to implement this process in the clinic. And then we don't need anything except a paper and a pen.
I can feel when I'm writing, like my anger build up, when I'm writing about the little details and stuff like that. My emotions were high, but towards the end, I settled down, calmed down, and actually having someone there to talk about it and reflect on it after the 15-minute writing session is done, and figure out like how your emotions are feeling, how can you regulate those emotions and all that.
It was hard for them to share their pain.
It was hard to even consider that at first, to even consider writing any of it down, because I still didn't know what it was. So we had to pick something to start from, But what I would say is, even though it sounds ridiculous, when you can stomach whatever it is you wrote, read it real quick. Otherwise, you won't be able to identify. You won't be able to forgive no one.
When you're screening your patients, you have to be very familiar with the process and know that which patient should be allowed or get the written exposure therapy. Because not everybody is a good candidate or a good patient to receive this therapy, because they have to commit themselves to come to the sessions at least 6 times to gain the kind of confidence to experience the treatment, and then it just allows us to see the result.
The writing sessions helped immensely. A lot of my life has changed. Nothing, and it has changed for the better. And I really want to credit that to these writing sessions. I do. I absolutely would recommend this type of therapy to someone experiencing PTSD. Absolutely.
It's easy for staff to learn, and it's a way of being patient-centered or patient-first in allowing the people who want a psychotherapy to do one in the setting where they prefer to get treatment.
If they believe they are there for their patients to provide the best care, this new approach, the written exposure therapy, based on my experience, is a way of helping patients. And as a leader, I have to say, we want to help and have a healthy community.
I love being around good people and just good vibes and all that. So it's great. It's great to be on the right path.
One day at a time. Yeah. The journey for me is all I gotta do is get through today. And then tomorrow, we'll think about that tomorrow. Yeah. I feel like I'm on a road to being saved in some way,